Welcome to the Aesthetic Doctor Podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello, friends, and welcome to episode 103 of the Aesthetic Doctor Podcast. I am your host, Dr. Judith Borger. Today, I am overjoyed to be joined by Dr. Giselle Prado-Wright. We are going to be talking about all of the body sculpting techniques and really all of the secrets behind body sculpting. We'll be talking about BBL, liposuction, fat transfer, what's kind of happening in the field, and more. Dr. Prado-Wright is a cosmetic surgeon, entrepreneur, and the founder of Exert Body Sculpt, a fast-growing office-based body contouring solution in the U.S., specifically in Florida. Dr. Prado-Wright has led and scaled her practice to the success it is now by operationalizing efficiency, integrating advanced technology, and building a franchise model that helps surgeons launch profitable cash pay practices. Dr. Prado-Wright is an active leader in the American Academy of Cosmetic Surgery and specializes in awake liposuction and facial balancing procedures. I am so excited to talk to her about all of that. So please join me in welcoming today's expert, Dr. Giselle Prado-Wright. Well, Dr. Prado-Wright, I'm so excited to have you here today. And tell me first about your practice. You have a very interesting body sculpting practice. What are some of the things that you do in your practice?
Well, body sculpting, it's in the name and it's a big part of what I do. Probably 60-70% of my time is doing liposuction, body sculpting, fat transfer, all these procedures that are so popular, and they're just becoming more popular the more exposed that we are to social media and these ideal body types, for sure. So I built my practice in Fort Myers, Florida. I've been doing it for about 5 years now, and we actually just moved into a much bigger, grander space a couple of months ago. So things have definitely been going well. And then we also have med spa side to the practice. We do hormone replacement, weight loss, so really kind of a one-stop shop for anybody that wants to look good and obviously feel good as well.
Yeah, so one of the big things I wanted to talk about today is BBLs, because we know that BBLs have really been the fastest growing aesthetic surgical procedures in the past decade. And there's a lot of social media exposure, there's a lot of celebrity exposure. And with that, obviously, come the risks and complications. For our listeners who might not know what BBL stands for, would you just go into what BBL is and then sort of what are the steps as a practitioner that you take to perform in this procedure?
Yeah, so the BBL, sometimes in the med spa world, we get confused with all these acronyms. So in the laser world, it's the broadband light, but in my world of cosmetic surgery, it's the Brazilian butt lift. And I've met a lot of Brazilian surgeons and they don't love being associated with it. So essentially the procedure is you're going to do liposuction, you're going to take unwanted fat from other areas. It could be the arms, the thighs, anywhere. Typically, it's done with a 360 lipo. That means 360 degrees around the entire midsection. So you're getting rid of the stomach fat, the flank fat, the bra roll fat. And then you take this fat, you process it, and then you re-inject it anywhere in the butt that you want to augment. And it's a really great procedure because, one, it's permanent. It can look really natural. And it was really in high demand, especially during COVID, because the Kardashians, what we're seeing on social media, everybody was getting a BBL. But there definitely were some complications from too many procedures being done by one surgeon in one day, kind of the the volume style of practice that developed, especially in Miami, where they were giving super cheap prices and they were just getting in as many people as possible. So if you Google BBL now, it's probably BBL deaths. There's other complications related to infections, related to problems with the liposuction. And yeah, it's gotten a bad rap as well.
Yeah, so let's kind of break that down. Who would be a good candidate for a BBL? And what I've always wondered, and what some of my patients have asked me is like, how much fat do you need to have on your body to get enough once you harvest it and process it to then be able to get a good cosmetic result?
Yeah, that's a great question because right now everybody's doing the weight loss drugs. So they're kind of getting to that limit where they don't have a ton of fat to be able to do the transfer. So for me, when I look at somebody's body and ideally I can touch them, I can do the physical exam and really feel the skin quality of what is skin versus what is that good full fat feeling. I shoot for at the very minimum, you want to get a half liter of fat from whatever areas of liposuction you're doing. And that would be a very modest BBL because then you have to think you need to split that into two butt cheeks, right? And there's always some loss in the tubing and the canister. It can never be perfect. So the minimum I would say is about half a liter. Ideally, what I would love is if I can get 1.5 liters, then you can put at least half a liter into each butt cheek. You've got a little bit extra just in case you need to refine something, just in case you spill some, because this is a very messy procedure. So that's what I would say. And then typically BMI wise, if you're thinking to yourself, well, am I going to have half a liter? Am I going to have a liter of fat on me? If your BMI is higher than 22, 24, you're probably going to have plenty of fat in your midsection to do this kind of procedure.
I love that. Thank you. And when you spin it down, you said you want 1.5 liters. How much do you end up with processed? Like, how much do you cut it down by when you process it?
No, I would say that's what you need done. So when you're taking the fat out, what you're taking out is a mixture of fat, connective tissue, and then you have your tumescent solution, which is what you use to prepare the area to do lipo so that you get minimal bleeding and it doesn't hurt, basically, and all of these things. You let it sit and it kind of decants. And then the top portion is your fat and the bottom portion is what you don't want. So you let all that go away. And then you add antibiotics to your solution. You can add, I mean, this is getting like very technical, but you add things to it, mix it all up. You kind of make a little potion and then you get it ready to re-inject. So
no, I think this is awesome. It's like fascinating. And I do love how you're like, and I like to feel some juicy fat. It's like the opposite of what most people say. You're like, ooh, and this is great right here to suck out.
Yeah, no, you want it to have a thickness to it.
Awesome. Obviously, like you mentioned briefly about the possibility of death and BBL deaths. And what we're probably talking about is the most commonly feared and reported cause of death would be that fat embolism, right? Which is where fat gets accidentally injected into a vessel and then it causes an embolism and it can lead to permanent disability or death. The BBL has a distinction of having the highest mortality rate of any aesthetic surgical procedure. And like you mentioned, South Florida has the highest BBL mortality of anywhere in the country. So I read a really interesting article recently, and that it talked about exactly what you mentioned, that they kind of found in their investigation, and there was apparently a whole South Florida task force and all these guidelines established that I'm sure you know better than I am practicing in Florida, where they were really saying that these budget high volume clinics with maybe not expertly trained staff had by far mortality rates that were outpacing even what they should be based on the volume that they were doing.
Yeah, during COVID, it was a really big problem because it was kind of a confluence of factors. I know you're in the med spa space, but people had a lot of money to spend. Between easy financing, the stimulus checks, the fact that people were working from home so you could get your procedure and recover at home and still
well, also we couldn't spend it on travel, right? You couldn't spend it on restaurants. Like you couldn't spend it on concerts. Like there was all these other things that you just couldn't spend your money on.
Yes, and you spent a lot of your day looking at yourself on camera. People had never looked at themselves as closely as they did during COVID. So now everyone's, wait, I can get plastic surgery. I can fix this. I can borrow $5,000-$10,000 with very low interest. Like it was perfect for plastic surgery. So then all these centers, I know people, I have friends, they were doing 10 procedures a day. The surgical assistants tell me they would start at 5 a.m. and at 10, 11, midnight, they were still going. And they would do the same thing the next day. And they were operating on Saturday and Sunday as well. And that's where these problems started. And it obviously got picked up by the media because if you're a 20 or 30-year-old woman and you die from plastic surgery, that's something was very wrong, because a healthy person should not be dying from this. I think, honestly, the complications related to general anesthesia are not nearly as widely reported and are much more common for causing deaths. The DVTs, problems with perforations, all these things that like they end up in the ICU, but maybe they don't die from it. So that isn't reported as much. But yeah, a lot of problems came because of that like practice model of doing a lot for a little bit of money and just trying to get as many people in as possible. So I don't think
And a lot of times once we have corporate money and chains getting involved, we're not chasing excellence anymore, right? We're chasing, I mean, we see that with all the Botox budget things too. We're not chasing excellence. We're not chasing patient outcomes. We're chasing how many people can I get through in a certain amount of times. And then, of course, there's obviously techniques that we don't need to get into, but that also skilled surgeons will know that will way decrease your complication rates in terms of how to inject.
well, in Florida, I'm sure they talked about in the article, like legislature had to get involved and they made a lot of mandates and temporary things that only a couple of those now actually got permanently put in, but one of them being the ultrasound. Florida is the only state that actually mandates ultrasound usage during fat reinjection. And that is something that that's great. It doesn't matter, even if you're tired, whatever, if you can visualize where that cannula probe is, then you're going to be safe. Like there's not going to be any injection of fat that can cause an embolism if you're in the right plane.
Now, you do all of your procedures awake, or most of your procedures, or all of them awake?
Oh, all of them awake. Every single procedure awake. And my partner, I got her into awake too. So she'll do awake tummy tuck, awake breast lift, everything.
Now, do you do that all with local numbing, or do you do moderate sedation, or what do you do?
Yeah, so it's local numbing. They don't have to be under, there's no LMA, there's no propofol, there's no IV. I kind of tell the patients during the consult, it's similar to going to the dentist. And I also tell them, I've had this procedure done. I've had my chin done. I had my 360 with a fat transfer to the butt. Like I've run through the whole thing. So I know how it feels. It's kind of uncomfortable when the numbing is going in, similar to the dentist. You feel a lot of pressure. It feels weird. But once it's fully numb, you're just going to feel like, oh, something might be moving. You might feel pressure, kind of like a C-section, but you're not going to feel pain. You're not going to feel sharpness. You can do the entire thing. And the sedation, I would say, comes just from lorazepam that we give them oral pills. We started using recently a really great pain medicine called Jornavax. I don't know if you've heard of it. It's not opioid. It's a selective sodium channel like pump blocker. And that's been like really amazing for our awake procedures as well.
That's very cool. And yeah, because like we talked about earlier, there are definitely complications to anesthesia, and not everybody is a candidate for anesthesia either.
Yeah, I talk about that on social media a lot too, that if you're going to have a set number of procedures in your life, and when you're older, you're probably going to need a hip replacement, a knee replacement, maybe God forbid you have cancer, you're going to need to be put under for those procedures. You don't have an option. Maybe kidney, who knows? So if you can do elective procedures, much lower risk, you can do them awake, you decrease the number of times that you're put under, then that's going to make your outcomes better for your entire life.
Yeah, absolutely. Cumulative over a lifetime. So tell me about, or tell our patients a little bit about like the BBL aftercare. I think everybody has heard about the donut pillows and all of the things. What do you tell your patients to expect for aftercare?
Yeah, so like I said, I ran through it as well. So I had that firsthand experience. And the most important thing that you can do is obviously listen to what your surgeon says. You really have to wear your compression. So the areas that get liposuction, you need compression so that you don't get any fluid collection, so that you minimize the swelling. So those areas, it needs to be tight. If you can get some lymphatic massages, great. That helps the fluid move a little bit more, get to the kidneys, you pee everything out. Perfect. With the pillow that you're talking about. So what I recommend is 6 weeks where you're kind of sitting supported so that most of the pressure is on your thighs, it's on other areas, not directly where the fat is placed. There's never been a study, a randomized controlled trial, a cohort, nothing to say if you do 6 weeks, if you do 12 weeks, if you use this pillow, if you use that pillow. So this is more handed down clinical practice more so than, hey, this is the best way to do it. So what the theory is, when you don't put pressure on the newly transplanted fat cells, more of them will get that blood supply, more of them will be able to live. You avoid fat necrosis. So I say minimum 6 weeks, but you're human. You're going to have
Yes.
to sit down every once in a while.
Yeah, and for those of you who don't know what Dr. Prado-Wright is talking about, when you inject fat, it's not like a substance that like a filler or an implant that you put in there that just stays in there and is foreign to your body. The fat actually does sort of become integrated in that area and grows a blood supply, but never 100% of it will. So again, and what she talked about is another of those complications where necrosis would be that the fat basically doesn't get blood supply and essentially as tissue dies. What do you want to say about sort of the percentages that are expected to like stick and get integrated and be permanent?
Yeah, so in the literature, there's a very wide ranges also reported. I tend to tell patients 50 to 80%. And if you really want to get maximum fat retention, you can't smoke. Like that is going to kill fat more than anything. Anything vaping, anything that decreases blood supply, don't do it. The sitting down is part of it as well. Try to stay off the butt as much as possible. And then what you eat is really important. You can't lose weight during that initial period. So you want to be doing high protein, high fat. It's not that you're trying to gain weight, but you don't want to have anything stopping that fat from having the building blocks that it needs to survive.
Yeah, you don't want to be in like a catatonic state or a calorie deficit or something like that where your body's, oh, let's take it from here.
Exactly. Yes. You want to you want to give it the right, you want to let it grow.
Yeah, you want to plant, feed the plants,
Yes.
water
Feed
the
your fat.
seeds. Yeah, feed your fat. That's pretty awesome because I'm sure a lot of patients are like, oh, I haven't been told this in a while.
Yeah, well, they get to kind of eat a little bit more before the procedure because they know they're getting lipo too. And then after the procedure, at least for the first 6 weeks, they kind of get a little bit of a pass.
Perfect. So we were talking off camera and you actually, now I know that you do like also liposuction by itself. And even though I don't perform liposuction, I actually refer a ton of patients locally for liposuction because in my opinion, like none of the non-surgical body contouring and body sculpting has really been like found to be that great. I mean, at least I haven't seen one yet. So, when people are like, oh, should I do cool sculpting? I mean, cool sculpting is kind of out, but should I do this or should I do that? I'm always like, listen, if you really want it done, go see these surgeons that I can recommend and just get the lipo because it's going to be permanent. It's essentially guaranteed to work. And you're not playing this game of half an inch here or there, maybe, that we do with a lot of the non-surgical body sculpting.
Yeah, I have a lot of patients that come to me after trying other non-invasive things, and I tell them, great, you came to the right place finally. You're going to get minimally invasive here, and you're going to get a result that you can show somebody, this is me before, this is me today, and you're going to see a difference. You're not going to be like squinting, zooming in, like playing with the lighting. It's going to be obvious. Sorry, the light in my office just went there. There she goes.
That's okay. Yeah, it's going to be obvious. Yeah, absolutely. And so you were saying though that I knew that you did a lot of the breast augmentation again. Do you want to talk a little bit about that for our listeners that might not be aware?
Yeah, so breast fat transfer, I think is more popular now than the BBL. Like BBL kind of peaked during COVID, and now breast fat transfer is having its time to shine. I think there's a lot of concern about breast implant illness, about breast implants triggering other autoimmune problems. So there's a lot of women that are either explanting, removing their implants, or women that want breast augmentation but are afraid of getting breast implants. So there is an option that you can use your own fat to mimic breast tissue. You're never going to have this Instagram implant result. It's not going to be, like I say, tits to collarbone. Like that is not realistic for breast fat transfer, but it is a very natural where you can get 1 cup size increase. And if you have the people who are great for this are women that have already had children, so they already have the big breast that then deflated. So there's
Right.
space.
So the post breastfeeding kind of thing.
Yes. Then you put fat in there. It helps with the skin quality. It makes it look fuller. It's still going to have a natural breast shape. Even if you decide, hey, I'm going to get a breast lift, but I don't want to go with the implant, then you can also get a fat transfer. I've also done it on women post mastectomy that didn't want implants as well. So I think it's a great procedure.
Now, when you inject the fat for the breast transfer, like which space do you inject it in normally?
So when I'm doing the breast fat transfer, we're basically going into the fatty layer that's under the skin, but not getting into that glandular breast tissue. And then there's another layer that's deeper right on top of that pectoral muscle that has fat in it as well. And I get really good projection and really great fat take when I do both layers.
Awesome. So basically layers that have fatty tissue
That
already.
have fat in them, yes.
Okay.
Because what the problem is, and when I first started doing fat transfer, I was actually re-injecting more into the glandular breast tissue and I was getting more problems with cysts. And then as soon as I started re-injecting only into the fatty layer, I haven't had that issue.
I love that. I love that. And you were telling me that there's even like penile enhancements now that you do. Let's
Yes.
talk to you on that.
Yeah, so when I first started doing male enhancement, I was just using hyaluronic acid fillers and putting them, the same thing, under the skin on top of the muscle. And I was getting really great results, but patients wanted something that's a little bit more permanent. And I'd already been doing BBL and breast fat transfer for years. So I said, let me apply that to the penis as well. And read a couple of papers on it, watched some videos on how to do it. The technique is very similar to doing it with hyaluronic acid filler. The processing of the fat is the same as when I do it with other areas of the body. It's just kind of a smaller area. So we talked earlier about how much volume a BBL takes. For a penis fat transfer, you're looking at about 50 milliliters to 100 milliliters. So it's about one.
So you can be very lean and still get the
Yes,
girth
you
to
need
your
a tiny
penis.
bit of fat. And you know what looks great? When you do pubic area liposuction to harvest the fat. So now that pubic fat pad is smaller. That makes the penis look bigger. And then you add the fat for the girth, and the patients love it.
That's awesome. And for the breast transfer to the breast, how much volume do people generally want or need for that?
So I tend to see 2 types of patients for breast fat transfer. One is the thin kind of breast explant crowd. So they had implants before, they don't want that look anymore. They're very thin, so they need a perfect liposuction, I would say. With them, if I can get half a liter, I'm happy. If I get 400, I do it anyways because they tend to have smaller breasts to start with. So if you put 150 mLs, 250 mLs per breast, it is a noticeable difference. It looks great. When you have the postpartum, like regular mom, the balloon, the breast is like a balloon. It's a lot bigger. So you have more space to fill, especially if she has her own natural breast tissue as well. Sometimes with them, I'll do 500 milliliters, 550 millimeters. There's more room to play with.
Got you. Got you. Got you. Now, I know you do a lot of chin lipo as well. Tell me, what are your most favorite sites that people come to just strict lipo for?
Yeah, chin is my favorite area to do liposuction because the results are immediate. The downtime is so little that just it gives them such a confidence when they take a selfie, when they FaceTime with their friends. Like it, it's crazy. Even for women that are very thin to start with, they just have a tiny little potato, but that's what we all obsess on. We're all looking at ourselves and we're saying, oh, but why can't I look like so and so on social media? So I love the chin for the confidence boost personally. My other procedure that I love really is arm liposuction is another favorite because I do it a little bit differently. I treat the arm all the way around. So we call it 360 degrees of the arm as well. And I think that you get a better result, you get a better skin tightening result. And then you can also do muscle definition for people that I work out all the time, but I've got this stubborn fat on top. I can't see my deltoid. I can't see my tricep. That's another one of my favorite procedures where I really feel like an artist when I'm doing it.
I love that. I love that. So, any other places that you inject the fat that you harvest from lipo that we might not know about and that might be interesting to know for patients, future patients, general listeners?
Yeah, I would say I do face fat transfer, but not as commonly. The person for face fat transfer, it tends to be, it was kind of like the penis, where I started with doing filler and it became really cost prohibitive to continue to do filler. Plus the face was like so volume depleted. It's so deflated that they need these a lot of filler for it to look as good. So face fat transfer is another area that I like to do as well. I also think that fat, not just think, but it's been proven. It has a lot of regenerative properties as well because there's stem cells mixed in with the fat. So it actually makes the skin quality better when you use fat for face as well.
I love that. Does that have any effects on like future procedures like facelifts that people might be thinking about in 10 or 15 years? I know a lot of facial plastic surgeons do their own fat transfers at the time of facelifts.
Yeah, so there's a lot of controversy right now where everybody that does facelifts is going online and saying, don't get filler, don't get the RF microneedling, don't basically do
Which is
anything.
so funny. It's because that same crowd that's going to get a facelift, right? When they're like 45, like me, are going to be like, okay, what can I do? Right? It's so funny. I think it's hilarious when that happens because it's like you're not going to have somebody who's never had done anything and then suddenly is going to decide to have a facelift. It's like starting with heroin. You just don't do that, right? It's the people that already get their Botox, that already got their lip fillers, that may or may not have had a bleph, that have had biostimulators. They're the crowd that's going to get the facelift.
Yeah, I think it's very unrealistic to say I'm going to have this virgin face to work on and all these planes are going to be perfect and my result's going to be so much better because I never had anything done. And it's cool, but maybe I spent the past 10 or 15 years not looking my best because I didn't do anything. And everybody around me was getting the Botox, was getting the fillers. Like that is the status quo now. So the genie is out of the bottle and the facial plastic surgeons, they need to deal with it. I'm sorry.
I 100% agree. Plus, I mean, like I said, it's the same population. The people that get stuff done are the ones that are going to be shelling out 50 to 100,000 for a facelift.
Exactly. And I have so many patients that they've been with me for years and they say, next year I'm going to get a facelift. And I see them every year and they don't get the facelift. And I say, hey, what happened? You said you were going to do this thing and they don't do it. So for them, I think they're the large majority, the 90% are going to be okay with the injectables, with the lasers. And then you have that smaller share that'll say, hey, yes, I want to be even tighter. I want more natural. I'm ready to get the facelift. But this focus on just get a facelift when you're 30, there are a lot of surgical complications related to getting these procedures. And that's what, now in aesthetics, I'm sure you've noticed that people just obsess on one thing for a few weeks and go to the next thing. So right now it's filler complications, filler puffiness, filler is bad, go get a facelift instead. in a few years, it'll be, okay, well, we all got a facelift at 30, and this is my hypertrophic scarring, this is my nerve paralysis, this is my volume deficit. Like, that's what we're going to see.
Well, and I mean, again, aesthetic procedures can add up over time, but facelifts are very expensive. They have a big downtime. Like you said, there's complications, there's scarring, I mean, I've had multiple patients in my practice that, like you said, have scarring from facelifts that are not subtle. So I feel like everything is a risk-benefit analysis. And honestly, personally, at 45, I personally don't feel like I'm ready yet to get a facelift either. Am I going to get one? Ultimately, but I feel like I want to have one good one. And
Yeah. And I think what we're also kind of glossing over is we have facelift patients in our practice. A ton of
that's
patients.
very true. And they still need fillers, and they still need volume, and they still need lasers.
I have so many patients. I had a facelift, I had a neck lift, I still have loose skin here. Can you do Renuvion on me? I did a ton, because the skin quality didn't change. They still need Sculptra, they still need filler, they still need tox every 3 to 4 months. So this idea of a facelift is gonna cure everything, it's disingenuous.
I think you bring up a really great thing, because you're absolutely right. Like the facelift patients, and I think in a way they more than anybody want to maintain. So you're absolutely right. Facelift will help with tightness of your skin and all of that, but it does not help with volume loss, does not help with some of the skin texture problems we can address with lasers. It does not help with pigmentation, does not, and aging still progresses, right?
Exactly, or just redraping the skin.
Yeah, yeah. And I've actually had some plastic surgeons send me some patients for like pre-facelift, almost like skin conditioning, where they were like, hey, we need a session of fracs, at least like a good session of 3 fracs treatments, or I will not even do this facelift because the skin quality isn't good. So I think that's actually almost like a very smart thing to get the skin quality better and do some of the resurfacing and things like that pre-facelift, so that once you then pull it, it actually looks great.
Yeah. And I think we're seeing a lot more focus on internal health too, of the hormone replacement, giving them estrogen so that they do have more suppleness to the skin, that their collagen actually grows. They're not as dry and like kind of withered. So I think that the industry is definitely moving to more advanced protocols and coupling more things than we used to.
Yeah, and I love that you're doing all of it in your practice together, that you kind of combine the body sculpting, but then you do the hormone replacement, you have a med spa. So if people are in the area, where can they find you? What's your location, and how can they find you online? Because I actually really enjoy your social media. You do a great job. So tell us all the things.
Oh, thank you. Yeah, so we're located in Fort Myers, Florida. We have a big headquarters here, 13,000 square feet, with the full surgery, the med spa, replacement, weight loss that we talked about. If you want to find us, it's exertbodysculpt.com. It's EXERT. And we do take on new patients, obviously. If you need help with any of these services, we actually draw people, I would say, from all over Florida. I get a lot of patients. We have one tomorrow. She's flying in from Canada. That, like you said, they find me on social media because we put so much educational content out there so that they feel really prepared for what their experience is going to be. And they like build a relationship with me before they ever meet me in person. So yeah, I think it's been great being on social media and sharing so much.
And with that being said, do you also do video consults? Let's say if somebody is somewhere else and wants to fly down for the procedure, do you do video consults beforehand?
Oh, absolutely. I would say actually 70% of our consultations are done virtually. So we're set up for the telehealth, and we have a guide where take your pictures, upload them in here. Even people that live locally, we get a lot of patients from Naples, which is about 45 minutes south of us, and they don't want to make the drive for the consult. So we tell them, hey, you just have to come on the day of the procedure. Your consult, your post-ops, everything can be done virtually.
I love that. Well, anyway, we will also link everything in the show notes. And thank you so much for being here and sharing all your wisdom and expertise with us and our listener. Is there any other kind of words of wisdom you want to share before we go?
Oh, I think we had a fantastic conversation, and thanks so much for inviting me. And, what we talked about earlier, that you can't wait until you're 60 or 70 to get started and then hope that one thing is going to fix it. You really have to treat it kind of like a journey. Of something bothers you, you get it taken care of. Maybe your doctor recommends a series of treatments or a whole plan for you. Don't think of it as just, well, this doctor's trying to make money off of me. No, that's probably the most optimized thing that you can do.
I love that you said that, because I say that to new patients all the time. This is a journey. We're starting somewhere and we're ending up somewhere, but it's a journey, like life, like aging. And like you, I love when I can kind of accompany my patients on that journey over time. And it is amazing how sometimes 5, 8, 10 years later, even though they have aged chronologically, like they look so much better. And like you mentioned too, most importantly, they're so much more confident.
Yes, that's what it's about. It's making them feel confident, whatever stage of their life they're in.
Well, thank you again for being with us. And thank you to all the listeners for tuning in. We are linking all of Dr. Prado-Wright's links and website and Instagram in the show notes. So be sure to follow her and check her out. And maybe you can even get some of that amazing body sculpting. Like, I feel very tempted now, I'm going to tell you.
Those before and afters got you.
Thank you for listening to the Aesthetic Doctor Podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.